If you've got type 2 diabetes, I'm sure you've seen them everywhere. Supplements that promise the world better blood sugar, weight loss, you name it. The internet is just flooded with advice, right? But what's actually helpful and what's just plain risky? It is a super confusing world out there, and today we're going to cut right through all that noise.
So that's the big question, isn't it? Are these supplements a real helping hand for managing diabetes, or could they actually be a hidden health hazard? Well, the answer, it's a whole lot more complicated than you might think.
All right, here's how we're going to break it all down. First up, we'll look at the case for caution. Why experts are telling us to slow down. Then, we're going to hit a really surprising twist I call the deficiency double bind. After that, we'll sort through the messy middle of what's helpful versus harmful, and we'll wrap it all up with a clear expert takeaway that you can actually use. Okay, let's dive right into why we need to be careful. While so many of these supplements are marketed like they're some kind of magic bullet, the medical community is pretty much united in advising a very, very cautious approach. And this quote from pharmacist Dr. Joyce Yaley, it just nails the expert consensus. The evidence just isn't there yet. And more importantly, these supplements are not one size fits all. What might work for your neighbor could be totally useless, or let's be real, even harmful for you.
So which specific supplements are raising these red flags? Well, first on our list is beta-carotene. You probably know it as the thing that makes carrots orange and turns into vitamin A in your body. Sounds healthy, right? Well, here's the deal. Getting beta-carotene from food, that's great. But taking it in a concentrated pill is a totally different ballgame. Some pretty serious research suggests the risks might actually outweigh the benefits, even linking high-dose supplements to an increased risk of cancer and worse cardiovascular outcomes. The takeaway here is simple. Get your nutrients from your food, not from a bottle.
Okay, next up is bitter melon. This one gets marketed with a pretty powerful nickname, natural insulin. But honestly, that label can be dangerously misleading. For starters, the science on bitter melon is kind of all over the map. The results just aren't consistent. But more importantly, if you're already on medication to lower your glucose, adding this could cause your blood sugar to crash to dangerously low levels. And on top of that, for people with a common genetic disorder, it can even trigger anemia. So yeah, definitely want to be cautious about. Let's talk about chromium. Now, this is a mineral that for sure plays a role in how your body uses insulin. But, and this is a big but, that does not automatically mean that taking it as a supplement is a good idea. There's a really good reason the American Diabetes Association specifically says don't take chromium supplements. There's just no clear evidence that they help. In fact, your body is way worse at absorbing it from a pill than it is from whole foods. Plus, it can mess with your meds and poses a real risk if you have any underlying kidney or liver problems. All right, now for one that might surprise you, vitamin C. We all tend to think of it as completely harmless, right? But for people managing diabetes, taking it in high doses can create a very specific and pretty serious problem. So this is where modern tech gets involved. It turns out that high doses of vitamin C can actually interfere with continuous glucose monitors, or CGMs. And what that means is it could potentially hide a dangerously low blood sugar reading. So if you use a CGM, it is absolutely critical that you check the manufacturer's guidelines on this. Seriously. And finally, let's get to the big one, cinnamon. It's probably the most popular blood sugar lowering spice out there. And look, sprinkling some on your oatmeal, totally fine. But taking it as a high-dose supplement, that's a whole other story. The scientific evidence on whether it actually works is still really murky. But what we do know is that the super concentrated forms you find in supplements can be rough on your liver. That's because the type of cinnamon most supplements use, called cassia, has high levels of a compound called coumarin, which is a known safety concern for the liver. Okay, so far the message seems pretty straightforward, right? Be really, really careful with supplements. But this is the exact moment where our story takes a sharp and pretty confusing turn. You're probably thinking, okay, got it. I'll just avoid all supplements. Case closed. That seems like the logical takeaway from everything we've just heard, doesn't it? Well, not so fast. The reality is much, much trickier than that. Check out this number, 45%. According to a huge analysis of over 52,000 people, that's how many folks with type 2 diabetes are deficient in at least one essential vitamin or mineral. We're talking about nearly half the population. And it gets even more wild when you zoom in. If we just look at vitamin D,
A shocking 60.5%. That's more than 6 out of 10 people with type 2 diabetes are deficient. This isn't just some small issue, it's practically an epidemic hiding in plain sight.
And it's not just vitamin D either. We're seeing huge numbers across the board. 42% are low in magnesium, 29% in vitamin B12, and 28% in iron. So, do you see the problem? On one hand, we're told to avoid supplements, but on the other, a massive number of people with diabetes are actually deficient in key nutrients. This is what I'm calling the double bind.
So, how in the world do we solve this puzzle? How can something be both potentially dangerous and potentially necessary at the same time? Well, it all comes down to navigating the nuance of it all. Let's go back to chromium for a second, because it is the perfect example of this exact conflict. On the left, you've got all the reasons for caution we just talked about. But look at the right. Scientific reviews show that it does help insulin work better, that people with type 2 diabetes do have lower levels of it, and that certain doses have been found to improve blood glucose. See? This is why a simple yes or no just doesn't work here. And you know, sometimes taking a supplement isn't just an option, it can be absolutely critical. For instance, metformin, one of the most common diabetes drugs out there, is known to be linked to a vitamin B12 deficiency. In that situation, supplementing isn't just a wellness choice, it's about directly addressing a side effect of your medication. And we even have clinical trials showing that specific combos, like magnesium and zinc, can have real, measurable benefits.
So, where does that leave us? What's the plan? How do you move forward safely? Here it is, a clear 4-step action plan. Number 1, always start with your lifestyle and your diet. That's your foundation. 2, talk to your doctor. Please, don't try to figure this out on your own. 3, get tested. Find out if you actually have a deficiency before you start trying to fix one. And finally, number 4, if you and your doctor decide a supplement is the right move, you have to treat it like medicine, with respect for the dose, the timing, and any other drugs you're taking.
You know, in the end, this whole thing reframes the entire debate. We've got to stop asking, which supplement should I take, and start asking a much smarter question. Based on my food, my meds, and my actual lab results, what does my body truly need? That is the question that's going to lead to safe and effective management.